makeup on, but
Oh, that looks like this so good.
It does feel better when I'm like behind her.
Yeah.
yeah, because it kind of feels like a massage.
Her face looks like she doesn't even need a peel left.
That's because she is a good one and comes and sees me.
I do. I come in every about 6 or 8 weeks.
Yeah.
Like even, be nice friends.
Will I be blocking anyone?
No, you're perfect.
So with this peel, we can go on the neck as well. So that you get to treat the face and neck.
So there's different levels of this peel. Your basic entry level is called just a VI peel. And it's designed where you can treat fine lines and wrinkles. It does help to target some pigments. It's kind of like your perfect introduction. You are going to still experience a full peel from this. Then your next step up is going to be something called a purified peel. This is really more designed for somebody who's dealing with like acne. It helps specifically to target active breakouts. Then your most advanced step is called a Precision Plus. And this incorporates hydroquinone. So if you're dealing with a lot of either hyperpigmentation, sun damage, melasma, this is really going to be your most advanced step. This is melasma. So you have a combination. On your forehead is hyperpigmentation, but when you have those bigger brown spots, that typically winds up being melasma, and it'll show up on your cheeks, your forehead, your upper lip. Yep.
My sister
That's why I have to wear
Yeah, it's very common. A lot of times it's hormonally driven. So typically what starts to happen is your body's dealing with internal stuff. It thinks that there's trauma, so it's producing more pigment out to the front. Yes, ma'am. Yep. So essentially what we always suggest, especially if you've never done a peel before, we would start you on doing a VI peel first. Start with the entry level, see how your skin responds to it. You are going to still slough off the dead skin surface on the top. You are going to see a brightening. You are going to see a reduction.
photo facial first, or
You
go
can
straight
do it
to-
in combination, but I would tell you, what we've been doing is if we VI peel you first, the results from your laser are that much better because now you've taken off some of the dead stuff. The laser is just a light beam. When you slough off some of the dead stuff, now your laser is going to penetrate deeper. You tend to get a better result from your photofacial after you've done at least one VI peel. So we tend to do them in combination.
right there.
So I would suggest you start off with your VI peel, and then you can always work your way up to the Precision Plus. Because again, you're dealing with different strengths. We don't want to start you off right away at the Mac Daddy, and then you're going through a lot of recovery time because your skin's not used to that, and then you're kind of mad at us because that wasn't what you were expecting. So we like to do this in baby steps versus having it be something that's traumatic, that's not pleasant.
You made that look easy.
Right?
I'm a pro now. I do so many.
No, it takes a couple times and then you're like,
Yeah, I got it.
easy.
Used to like cut my gloves all up.
That's what happens to me if I'm opening one for somebody for a demo and I forget to put gloves on. That's when it gets on my fingers. Then my fingers peel.
And they peel way different than your face, I will tell you that.
No, like it gets
It takes like 2
underneath
weeks.
it. Yes, it's so weird.
Alright. I don't even know what time it is. Do we have a time?
6:14.
Okay.
So at 10:14, we have to put do the 4-hour thing.
See, she was paying attention. I love it.
Oh, I was.
Alright, ready?
I'm a rule follower.
Now what are you putting on?
This is the
This
peel
is the
itself.
peel itself.
Okay.
So as you can see, she's not squirming, she's not uncomfortable, there's no fan, there's no angst. The biggest thing
Like a little
is,
tingle.
yeah,
Her skin looks so good
I know.
to start with.
Well, I come in regularly for the micro peels. I have
so
to-
Angela, did I lie? It's pretty painless, right? I told you, the micro peels.
No, it tingles a little bit. It doesn't feel much any different than the micro peel.
Good. I'm gonna pull up on this screen so you can see a before and after picture of a person after doing just one peel.
That's me.
Is that more of the same that you're putting on?
Yes, ma'am. So what we do is we apply one layer, and then after a little, 30 seconds to a minute, then I go ahead and apply the second one, and we just apply until the solution is gone. Typically, I'll get like 7 to 8 passes on someone.
Oh yeah, I thought that was great. It was good.
Now that's just after one of the VI peels. So the introductory basic one, you're still going to see a great improvement. I mean, she's got a reduction in her brown spots. She's got a reduction in her fine lines and wrinkles. She has a beautiful, nice, healthy glow about her skin. There's no makeup or anything.
The glow looks great.
Yes. And that's essentially what it's designed for, is we're just helping you to take off all that dead stuff that kept building and building and building for you to just be left with some nice healthy glow.
How much time is in between this picture and this picture?
I would have to go and look at the exact dates for you, but if I had to guess, it's probably 30 days.
You can actually see the results. They're gonna be working that 30-day period, but you can
How you
actually
doing, Angela?
see when you're healing,
Okay.
you can see
Good.
that new skin
No, it's not
coming
even
in
bleeding
underneath
at
it.
all.
Good.
Yeah, I understand, yeah.
In fact, it's like even the tingling is pretty much subsided.
Okay, dear, thank you
So that's
much.
some of the ingredients in there. It's designed to numb. That's why I was telling you. So the nice piece about this peel is you can get your peel, then Botox and filler all in the same day in back-to-back appointments. So literally, she is now topically numb. So when she goes to get her Botox done, you don't feel the pinch anymore. So it's really quite ideal. The way that they've formulated the VI peel, it's really, this is state of the art where you want to be.
Yeah.
We're
And,
pretty excited
I
about
mean,
it.
I think what I like about the VI peel is some of the stronger peels, you were sort of stuck doing it from the jawline up. And there's versions of these peels that you can use on back of hands,
Yep.
on
Chest,
chest,
legs.
back.
Backs.
Yeah.
That's nice, cause I don't like my hands are starting to get spots.
Well, that'll be the thing. We'll have somebody who they've done so much to their face and neck, like this looks really beautiful. And then you see their hands and they're kind of like trying to like put them in their pockets, right?
Or they have like a turtleneck on, and
Yeah.
you're like, and then you're like, oh, your chest. But yeah, the hands is a big one. Everyone's always like, my hands
yeah.
give my
We
angel
both
away.
drive like this.
Yep. Especially when you spend so much
Just
time.
get
Or
drunk.
we have some who wear
I
gloves
actually
when they
I
drive.
know, I need to do that. Let's go buy some.
That's a good idea.
We have a patient who wears driving gloves.
Yes.
Sometimes, I know this is really dangerous sometimes, but when I'm on a major highway for forever, I
She
will.
steers with her knees.
No, I will stick a shirt in my window so that the sun
Oh,
is
yeah,
not
no,
hitting
yeah,
my
I
face.
Yes.
Yeah.
Yes.
Like,
No,
literally,
it's a
I
good
stick
idea.
the top of the shirt out the window and it's
I mean,
hitting
she
there.
rolls
Yes.
the window up and it's secured up. And
I just got the most tin I could have on my car, and it has
You just have to get one of those like baby ones, like
No,
the
I
pull
need
down
that. That's
shade.
what I need.
Pull down, those are good.
The pull down
get
shade.
gloves. I'm gonna do it.
I need to do it too.
So now, Noah, what makes you decide how many layers, or you just go until it's empty?
We use it up until the vial's empty.
Okay, now if she were to frost in the interim, do you just stop? Or
No,
there's
we
no frosting?
wouldn't. It would depend on how much she's frosting. So she's frosting a little bit, but if it was widespread, then I just wouldn't treat that area. Then we would.
What do you mean?
What are you saying?
So sometimes what happens with a product is when you're putting the peel on, it will start to self-neutralize itself because it's already done what it's going to do, so now it will frost. And then at that point, that's it. You don't want to continue to apply product because you don't want to cause any damage to the skin area. So you would, like Noelle's saying, you would then just avoid that spot. Sometimes back in the day when peels first came out, you would do one pass and almost the whole face would frost because it was just so harsh and so aggressive. So a lot of times, especially now as the peels are getting better and more advanced, like VI peel, you're able to apply multiple layers and you're not getting that blanch effect to happen.
And I just use the fan to speed up the drying process. So she's not in any pain.
Now you can see she has a little bit of rosiness, that's normal.
Yeah.
This will typically subside by the time she wakes up tomorrow morning. Again, a lot of this has to do with anytime you're doing a rejuvenation, you need to think about this as if it's a controlled trauma to the skin, right? So we are forcing the body to produce now new skin cells, which then form new collagen and new elastin. So it is essentially still a controlled trauma that we're using a product to do, but now that's what's going to help to produce that new skin underneath. So the little bit of redness, the little bit of what we call edema, which is redness, you want that to occur. That's how you know blood cells are going to the area. You're not going to get a good healing process that's going to happen.
Yeah, I was gonna say, if someone doesn't turn red, it's kind of a little scary. It's almost like, is your skin alive? Like, we gotta make sure something's pumping in there.
That's great. But you're not doing the neck.
Yes,
You
I
are
will.
doing the neck. Okay.
Mhm.
Okay.
And the next day you look great. I mean, I think everybody's
Yeah.
like so
Yes.
glowy.
Yep,
I'm
so
like, can my
that
skin just
actually,
stay like
glowy and
so
tight?
that brings up a good point. So the process that you should expect. So when you first do your peel for day 1 and day 2, you're gonna look glowing and radiant and nice and tight. Day 3 is when you're gonna start to experience some peeling and flaking. And most of it's gonna start where you're mostly animated. So kind of like in your laugh lines from talking, you're gonna start to see your peeling and flaking start here. Then by day, so 3 through 5 is really when you're going to experience the bulk of your peel. And when I say peel, I literally, this analogy is not the greatest, but think of snake skin or lizard skin. You're going to shed. Now, it's all dead good stuff. You want it to come off. You just don't want to pick at it, but we want you to understand for days 3 through 5, you're probably not going to want to go out. That's going to be the day that you're going to do like your slow cooker meal in the crock pot. You're going to do
Unless you're me.
your DIY project at home, that Pinterest thing that you were always trying to do, right? Or have your girlfriends come to you for some bridge. They don't mind if you're peeling, but you're not going to want to go out, right? Then day 5 through 7, now most of your peeling's done. You may experience still a little bit of flaking around like the hairline and stuff like that, but most of the big heavy peeling will be done. So it's really what you're talking about is days 3 through 5. So in the grand scheme of things, for 2 days worth of down time to get that result just off of one peel, it's pretty significant. You have no pain. It's a really amazing rejuvenation tactic, which is why we've been so excited to bring it into the practice because of what it can do.
And normally we will do it on like a Thursday like today, because then you can peel on the weekend and then you can kind of hide out and then go to work on Monday. You can put your makeup on and just be a little bit flaky.
I mean, or you can get your peel on Monday and peel during the week, and when you're at work, you tell everybody how wonderful your experience is, and then send them to us, and then you get a discount on the next peel.
Yes.
There you go.
So there's just different strategies.
Well, and that way you'd be done by the weekend.
Yes.
Yeah.
Yes.
Go out
So,
on the
who do
weekend.
you want to
Yes.
impress?
Yes.
The weekend people or the weekend?
Yes.
Definitely weekend.
Okay.
But as you can see, I mean, there's really it's nothing too much. It's,
And this is the VI peel.
this is the VI peel.
And this one we can go right up under the eyes, which is great because that's always our problem area.
Mm-hmm.
And a lot of peels don't let you do that. So
My skin looks really good right now.
Mhm. And it's gonna look even better.
I know, my stepmom got one done and she calls me on day 2 and she's like, I just want my skin to look like this forever. And I was like, you just wait.
How often would you do a VIPO?
So a lot of this depends on preference. So depending on what you're trying to accomplish for the first initial, you may need to do 1, 2, or 3 of them at about an every 30-day increment. Because you're gonna do this to the point where you've either reduced your wrinkles, you've improved your pigmentation, or you've reduced your acne. So once you do like a small cluster of them together and now you're happy with your skin, now it just becomes maintenance. So maybe it's you do some of the micro peels in between every other month or so, and then you come in 6 months or a year from now to do another one of the big VI peels. Okay, so a lot of it becomes, you might have to do a few of them up in the front. You get your skin to where you're really happy and you're glowing and you're beautiful. Then you just maintain yourself with facials, micro peels, the smaller stuff. And then you come in maybe once or twice a year just for your maintenance.
I think like fall, maybe like once in the fall, once in the spring is a good time.
Mm-hmm.
Like maybe in the fall before we go into the holidays and stuff is a good time to do
Yeah.
it. And then before summer hits again.
Yes.
For maintenance, for like upkeep. Yeah,
Mhm.
we said that first.
Okay, so if you wanna look
Oh,
up.
she looks very relaxed.
Yeah.
Oh, sorry.
Good. So this one we can go right up under the eye. You want the fan. The eyes are gonna sting a little bit when we do them because it's such thin skin, and then it's an area that we don't treat a lot, so it's like, oh my goodness. But. And then we can go right up here. Yes.
Get all that crepey skin.
Pigment. A lot of people get spots, the sunspots right up there, and
It looks so good and tight.
woo. Yeah. So tomorrow her skin will get real tight feeling, and look really tight, and then that means the peel process is starting.
Looks good.
Yeah. And then that's it. So it doesn't take very long either.
So the other nice piece about VI Peel is they do provide you with your at-home post-peel kit. So there's specific instructions that you'll have to follow as far as cleaning it, protecting it, and then obviously your sunscreen use. And that lasts for how many days?
The kit will last you get 2 packets of cleanser that last you your whole peel. And then your sunscreen and your post-peel protectant's gonna last you even past the peel. So a lot of people, because they're cute little travel size, like I keep my sunscreen in my bag, and then if I'm out and I need it, so you'll have leftover with that.
So what are you gonna do when you get home in a few hours? You
So
do
she
something?
has 4 hours from now, and then she's going to cleanse her face. And then that essentially, because right now her peel's still working. We don't do anything to neutralize it at this point. So it's going to continue to work for the next 4 hours. And then at that 4-hour mark, when she goes to clean it, it's then going to start the neutralizing process. And now she's ready to just go on her merry way for the peel.
Yeah,
so it's
she'll
going to
cleanse
continue
it,
to work for the next
and then she's
couple hours.
got towelettes that she'll use.
She
and
gave
that
me
helps.
a little baggie with stuff in it,
Mhm.
and yep. And so in 4 hours at 10:15, right?
Yeah,
Set your
she'll
alarm.
splash it
So
with
how
water.
do you feel?
Fine. It's not. I mean, there's a little bit of tingling, but not
Okay.
anything uncomfortable.
Good.
Yeah, not any. I mean, it feels basically about the same as the micro peel.
Awesome.
Yeah.
Awesome.
Can you push the one from the night into the morning?
So tonight she'll do the 4-hour towelette, and then in the morning she'll do her. So there's, for the first 2 nights, depending on when you get the peel, you've got some towelettes to use, and we go over that, and it's got an app. So this peel has an app that you download, and it walks you, it's like having me there with you. So it like sends you a text reminder, hey, it's been 4 hours, do this. You can upload selfies, which a lot of my patients love, because then they can go back and watch their peeling. They're like, look how I looked on day 2, and then it helps too if they're like, does this look normal, or you know, just helps them track it, and then it saves that for the future. So then when you do another peel, you can see what you've done. Hey, have I done this one before, or how did I look again? And so that's the fun thing about this.
Yeah.
Yeah.
Perfect.
Awesome.